We're especially proud of our very own Calvert County team at Patriot for what they've accomplished this year and for being a People's Choice Award recipient. So congratulations.
Thanks, Danita. We also have one of our primary partners and biggest supporters, Economic Alliance of Greater Baltimore, is also a sponsor of today's program and represented by the CEO, Michelle Welly. Michelle, would you like to say anything?
Sorry. So basically now.
Oops, somebody's not on mute.
Ready?
Okay, I think you're good. Go ahead, sorry.
Okay. Well, you know, I'm always happy to say a few words. Well, Danita had said the word of the hour, of the hour, the week, the day, the year, and that's pivot. The greater Baltimore region, which we represent, we're 7 jurisdictions, has been strong in manufacturing for quite a long time, in spite of the unsubstantiated rumor that manufacturing is dead. It's hardly dead in this region, and frankly, hardly dead in the country. We have what it takes to continue to grow this sector. We have the talent, we have the workforce, we have the educational institutions that are training workers, we have the tech talent that's needed for the increasingly technologically based manufacturing sector, and we have a region that with great synergy with logistics, so the manufacturers can get their product out, you know, out the door, on the road to where it needs to be. But pivoting has really been the key word. Stacey, you mentioned a few things that Danita did as well. You know, our manufacturers, you know, immediately pivoted to manufacturing what was needed, whether it was addressing the medical issues, PPP issues, whether it was designing an air filtration system for passenger train cars, which Norbrakes, which is headquartered in Cecil County, is doing. It's really been amazing. And that will continue, you know, I think as the pandemic has caused a lot of manufacturers to look at their supply chain, particularly supply chains that are global, and think, well, you know, maybe we should have more domestic, more product being manufactured domestically, and making sure that our supply chain is diversified enough and based domestically, that these global disruptions will continue, whether it's a pandemic or a typhoon or political strife. They will continue. So if there's a bright side to the pandemic, it's that we have a number of industry sectors that have immediately been able to address the need, whether it's biopharmaceutical manufacturing, e-commerce with logistics, or manufacturing with everything that you've already mentioned. To learn more about the Economic Alliance, just click on our logo, you know, on the program. You'll be directed to our website, and you'll learn more about how great the manufacturing industry is in this region. Thanks, Stacey.
Thanks, Michelle. So now I'm going to turn the program over to Mike Kelleher, who is the Executive Director for Maryland Manufacturing Extension Partnership, and their organization stepped up in a big way as both a sponsor of this program and Mike to moderate the program. Mike's going to talk a little bit first about what MEP did as a champion of Maryland manufacturing, and then he's going to pose a few questions to our panelists, asking each of them to share a little bit about their stories, and then a couple of general question or 2 or 3 as time allows. And then, like I mentioned earlier, we have left about 15 minutes at the end for Q&A, but continue to send comments and questions through the chat section throughout the program. So Mike, take it away.
Great. Thank you, Stacey. Good morning, everybody. Thank you, Stacey, and thank you, Mike, and thank you, RMI, for one, not only putting this great program together, but for organizing and putting together the entire Champions program. I think it's a phenomenal piece of work and a true testament to RMI. And it's frankly something that we really need for the manufacturing sector. The more we can tell the story of the great manufacturers that we have here in the state of Maryland, the better it is for everybody. So before we get started, I'm excited to be able to moderate today and to be asked to do that. We've got some great panelists who have stories that are just amazing to hear and amazing to tell. And as Stacey mentioned, we had, I think, 48 submittals in the COVID-19 response category, and across the board, really the manufacturing community stepping up was really amazing. And as Stacey said, the Maryland MEP, we're very proud that we were selected as one of the champions stories for the COVID-19 response. And I really, don't like to have Maryland MEP take the credit, because the real story there, and the real story in the COVID-19 response, is the manufacturing community. It's the manufacturers themselves, it's the partners, it's the stakeholders. Our role as MEP, much like RMI, we've been fortunate to be in this position where we can support and respond and bring together the manufacturers, and work closely with our friends at RMI to really get out there and share what that manufacturing community needs. So when COVID hit, much like everywhere else and every other industry, the manufacturing industry itself was really pretty greatly impacted. If you all remember, not all manufacturing was deemed essential in the state of Maryland. We had about 30 to 40% of the manufacturing community that was forced to shut down because they weren't essential. And those that did stay open and were able to remain open were forced with the new normal, the new reality of how do we keep our people safe, and how do we keep our workers safe, and how do we get product out there with disruptions to the supply chain and our customer base. So in response to that, the Maryland MEP, with our partners at RMI, with our partners at Commerce, with the other stakeholders in the community, really scrambled to try to bring together some resources and provide information out to the community. Our team here at MEP really took two different approaches. One was gathering and getting information out to the market around the OSHA requirements, the CDC requirements, the safe practices and safe return to work practices. And through that, the team really did a good job of gathering all of the information from the market and making that available. Things like our reopening playbook for manufacturers, providing some guidance, providing some templates, providing some tools for the manufacturing community to ensure their workers were able to resume safely. We launched, as Stacy said, we've all been on countless numbers of Zooms over the past 9 months or so, but we launched the COVID-19 webinar series. And what I think is most impressive was the willingness of the manufacturing community to get on and share their best practices, share their ideas, share their stories. And so MEP really, we saw our role as a convener of that information. We wanted to gather that. We wanted to gather those best practices and share them out to the marketplace, and make sure that everybody had access to the same tools and resources and information, so that we could all open and operate safely and get our manufacturing economy back to where it should be. And then the other real, the real driver, or the real way that I think my team at the MEP stepped up, and I don't take credit, I put it all on the team's efforts, is when COVID-19 hit, we had manufacturers across the state putting their hands up saying, we want to help. Mike Galeazzo knows very well RMI and RMI's board members and their membership, almost to a company, put their hands up and said, we want to help. We're ready, we're willing, we're able to manufacture PPE and other items. So Maryland MEP, with our partners, put together the Maryland Manufacturing Network Supplier Portal. And believe it or not, through that portal, we were able to get more than 500 companies in Maryland that were either making PPE and protective equipment, they were ready to, willing to quickly pivot and make PPE and protective equipment, or they were just willing to help in any way, shape, or form. And that supplier portal was designed to provide a platform to make it easy for buyers to connect with those manufacturers who were making goods here in Maryland. We were excited to put that together, to put it in a format that could easily connect buyers and suppliers. And I'm proud to say that to date, there's been more than $2 million in business that's been transacted through that portal in just Maryland emergency buyers and companies buying from Maryland manufacturers. I think to some of Michelle's comments and to some of Stacy's comments, the COVID challenge has really been eye-opening to everybody, but I think the more we can use it as a platform to strengthen our supply chain, fill some of the gaps in our economic supply chain, not just on PPE, but some of the other supply chains that have been impacted on the DoD side, some of the medical equipment side. If we can use that as a manufacturing community here in Maryland to get stronger and smarter about what we do and how we support the entire industry, I think it'll be really powerful for the state and a real opportunity for the state to move forward. So that's Maryland MEP's story. As I said, we're not the ones taking credit. We were merely a convener pulling together the amazing community that we have around manufacturing. You look at everybody who's on this webinar today, and you're all part of that ecosystem and part of that community. And so the more we can collectively support one another and tell each other's story, I think that the more powerful we can ensure that Maryland manufacturing is moving into the future. And with that, I'm going to use that as a great way to transition to our panelists, because as I said, they're the ones that we really want to hear from. They're the ones who have true champion stories of how they've stepped up and responded, and how their organizations were part of this phenomenal manufacturing response and COVID-19 response throughout. And so as we go through this, I'm going to ask some questions of our panelists and tee it up. But if you all the participants have any questions, please feel free to use that chat function, and Stacy or myself will try to interject if we get an opportunity. And with that, Mary, I'm going to start with you. We have Mary Sheridan from Notre Dame Prep. And Notre Dame, she's the director of STEAM, Science, Technology, Engineering, Arts, and Math for NDP. And Mary, we know that masks have been one of the most critical PPE items we have heard across the state. Every industry, every business is impacted. And your students and alumni came to the rescue to help out NDP meet that demand so that you could continue to operate and you could make sure your students were able to be a part of the recovery. Can you tell us a little bit about your story?
Sure, Mike. First of all, I want to just say good morning and thanks for having me. I want to take a moment to thank Micah Gazio and Peter Gourlay, Stacy Smith, and all the wonderful people at RMI, and all the wonderful manufacturer leaders that are here gathering today for providing an opportunity for us to share our story, for honoring the women from NDP as RMI champions for their personal response in their fight against COVID-19, but most of all for your leadership and all that you do within our community that inspires us as educators to produce young women who will continue to be future business leaders, future manufacturers, and innovators in the manufacturing industry. So Notre Dame Prep's a Catholic independent school for young women in grades 6 through 12 located in Towson. My first connection with RMI began with a seminar similar to this at the Foundry with Susie Gantz speaking from Lion Brothers. And it was at that time that I realized that the essential skills of critical thinking, collaboration, communication, creativity, the perseverance that Susie used to build her family business into a thriving global business was needed for women like her through education. And so we've been sort of modeling our STEAM program around creating those essential skills. And as a result, we were able to see the impact that it had in producing masks during a time of the pandemic. My first story is about Emily Wason. She's a 2019 graduate who came through our STEAM program. She received, she's a student at the University of Maryland working in or studying mechanical engineering, and she received, while she was on spring break, a request from a classmate in Long Island desperately in need of PPE face shields. And so the first thing she thought of was Notre Dame Prep and our wonderful fabrication lab and our 3D printers. And she went to producing the face shields. What was wonderful about the experience for Emily was that she was not only able to use what she wanted to be sure was a safe and approved design, but able to use her skills and our equipment to redefine the design so that she could actually cut the production time from over 90 minutes to less than 60 minutes in order to produce more shields. She also did a lot of research to figure out what kind of plastic shield she needed in order to attach to the headbands that she was printing. And for that was sort of all her skills that she had learned as a student. She said she took to thinking about anti-fogging, being able to properly clean the shields for reuse. And in the end, she spent she was able to produce her first 50 shields and send to Long Island. But in the end, she said, I can't stop here. So she provided PPE for nursing homes that were local, served by the Little Sisters of the Poor, volunteer workers at Our Daily Bread who were distributing food, even a local dentist who reached out because they were in need of offering emergency services for clients. And so they were unable to obtain PPE, but through Emily could safely obtain shields. Emily felt it so rewarding that she said it was really the driving force that she realized her STEAM education could make a difference and really serve the community. The second story came from what are now seniors, but at that time were juniors in our STEAM program. And that was Alyssa Edwards and Kristen Logue, who learned to sew from their grandmother at age 7, but after starting virtual learning in March, heard the plea on the news for face masks. And they decided this was an essential skill that they wanted to put to good use. So they got a pattern from Joann Fabrics and bought supplies using their family funds and began sewing day and night. But I think what became a kind of a great part of their ingenuity in terms of understanding from their STEAM experience that the resources were hard to come by. Eventually they began to run out of resources. And so at some point they had to redesign the masks so that they were still safe, but actually used the essential pieces of material. And the girls did some research and teamed up with an organization called Masks Now Coalition. What they recognized that the organization had no coordinated leadership in Maryland. So girls stepped up and became the state leaders. In their new roles, they began not only to receive donations, but they ran a portal to process the requests. They recruited a volunteer workforce, both among the NDP family and outside. They joined forces with the Baltimore Running Festival, who provided vintage t-shirts that were able to be used as masks as well as elastic bands for the masks. They recruited a local law firm to sponsor postage, delivering masks all over the state of Maryland to those in need. And this was while they were doing their virtual schooling during the day and mask making at night. So when I hear these stories, it's just wonderful to know that our students are taking the essential skills that we're looking to integrate into our program in STEAM. And estimated 300 hours of work, they were able to produce over 250 face shields and 7,500 masks, sent all over to institutions at Kennedy Krieger, Johns Hopkins Hospital, Healthcare for the Homeless, My Sister's Place, Baltimore County Police Department, the FBI, the Genesis Healthcare, Sinai Hospital, and Atlantic General Hospital, and so many more. I just feel that these women's skills, use their skills to respond to the needs of their community. And I think their every man, or in this case, every woman effort really made a difference. And as an institution, we always look to empower and enable and support their efforts to transform the world as part of our mission. So thank you for recognizing their heroic efforts.
Mary, thank you so much for that amazing story. Before we jump on to our next speaker, Mary, if you wouldn't mind, could you in the chat put your contact information? Because I can tell you all of these manufacturers on this webinar would love to figure out how they can get these girls to get excited about manufacturing and to stay in the industry. We're always talking about the workforce of tomorrow. And the more we can keep these girls excited and interested, the more it's great for us. So thank you again for that, sharing that story with us and for the work you guys are doing.
Thank you.
So next, I would like to introduce Rick Winchek from Patriot. They have a very interesting story themselves. They took a little bit of a different approach in their response to COVID. Rick, I would love for you to highlight what you guys did. If you could give us just a brief overview so that we make sure we have some time for questions and answers, that would be great. You're still on mute, Rick.
There we go. Can you hear me now?
Yep, we got it.
Okay. I'd also like to thank the Institute for putting this all together and everybody that's involved in the manufacturing industry here in Maryland. What a great group of individuals and companies that have joined together to fight this pandemic. I think that just real briefly, as I read through all of the stories, I found it very interesting and inspiring that there are so many companies that have joined with other companies to fight this pandemic, because this pandemic, it requires more than just one company. It's an effort that people are joining together to team up on this. We, in fact, joined up with the Army Corps of Engineers and the PODS company, which has these containerized moving containers. And we modify those containers to originally create basically ICU units for COVID positive patients to be treated outside of a hospital, where they've expanded beyond their capacity and they were looking for ability to treat patients outside. That has since transpired into the research side, where we have delivered these units across the United States to universities and healthcare facilities, where they are creating a scenario where they can treat additional patients without bringing them into the hospital itself. They treat these COVID positive patients outside in these units, where they can provide IVs, vaccinations, etc. We partnered with local manufacturing partners and created a new company within our company. We created Patriot Spaces and opened up a full manufacturing facility that we had not had prior to this venture. Partnered with carpenters, mechanical, plumbing, an engineering firm out of Baltimore to design and manufacture these units. The PODS units themselves were very unique, because the way that the pod is created, it's created using a plastic panel, and it lends itself to being able to be sterilized for medical use. So PODS had 40,000, I believe, PODS containers in their inventory. So we had a readily available structure that we could then modify to create a medical environment. So as we move through the process, we have modified now several hundred units. We've shipped them across the United States, from California to the state of Washington, Texas, Chicago, to the East Coast. We're in Florida. And we currently have one manufacturing facility in Maryland. We are in the process of establishing a second manufacturing facility in Maryland, which will engage additional resources and additional companies to support the effort. Unfortunately for Maryland, but fortunately for the United States, we are in the process of establishing a manufacturing facility on the West Coast to support the demand that has gone nationwide. And as of right now, we manufacture them here and then we ship them to the West Coast. And we
Rick,
found
if I could interrupt you just for a second, can you share what Patriot's primary line of business was prior to COVID and prior to partnering with pods to make these structures?
So prior to our work with the with Patriot and Spaces and the Pods program, we started as a government contractor a little over 10 years ago. And our primary effort in the government contracting world was working in hospitals. So we worked in hospitals across the United States with the federal government through the VA system, through the Army Corps of Engineers, through Air Force Army hospitals throughout the United States. And then we created this this PODS program in partnership with the Corps of Engineers, as I said earlier.
And obviously the expansion plans are great. Are you seeing increased or continued demand as we come into these higher case rates and second spike around the country?
We are. The government has launched Operation Warp Speed, which is the effort to provide vaccinations. And that new program has increased the demand dramatically as the hospitals are trying to create spaces to be able to accommodate millions and millions of people coming through for vaccinations. So the demand right now had originally been with hospitals and universities. It's now expanded. We're hearing from urgent care centers and pharmacies across the United States who are all looking to create a space in their parking lot where they can do drive-through vaccinations.
And is this something that you all have been able to support with your existing capacity, or did you have to really ramp up and scale for that?
We are ramping up right now to scale for that demand that is just exponentially increasing daily. The number of inquiries that we get every day is really staggering at this moment.
Excellent. Well, thank you, Rick, for your efforts and for the story. I think that one is a true story of innovation, and it's always good to hear Maryland companies that are growing and finding opportunity in a challenging time.
Thank you.
And with that, I would like to introduce our next panelist. He is no stranger to the manufacturing community. We're joined by President and CEO of Prime Manufacturing, Luke Chow. Luke, I know you guys have done quite a bit around this, and you've partnered with some other firms to meet the need. I'd be particularly interested if you could share as part of your story how you're seeing the effects of the supply chain and how Prime, as a US-based manufacturer, a Maryland-based manufacturer, is really positioned to help fill some of those supply chain gaps that we're seeing around the country.
Okay. Thank you, Mike. Hi, everyone. Good morning. And yes, I want to thank Mike Galeazzo, Stacy, you're amazing for pulling everything together. And really appreciate all your hard work. And you, Mike Kelleher. Thank you for all that effort and probably a lot of sleepless nights in the midst of the pandemic and trying to pull all these programs together. So we really appreciate all your energy and effort there. So yeah, as far as the COVID goes, I think this pandemic has kind of given the country as well as all of us a little wake-up jolt on how dependent we are on other countries to supply our medical needs and also a lot of other needs, including PPEs. Yeah, for the last year, just medical supplies, U.S. imported about $53 billion worth of medical supplies. So reshoring, even half of that would result in about 300,000 jobs, according to this reshoring study group. So despite all this spending of monies from overseas, the supply chain is still very fragile in terms of can be interrupted. So so when we're depending so much from overseas, any interruption in manufacturing from overseas is a big issue for us. They always give priority to their own citizens first, and then we become second on their list. So, and this happened recently with this disruption with a medical equipment supply company. And they were making these IV poles that sits on the side of the hospital beds where they hang the medication in. Anyway, they supplied to them, and all of a sudden they discovered that they could not get the supplies from China because the Chinese factories were closed. And their inventory started to run really low. So they were panicking, and so they were looking for a domestic supplier. And so Drew, credit to Drew at Marlin. So he got the project, and then he gave me a call and said, hey, look, can you make this handle? We need a plastic part. We can do all the metal parts, but we need these plastic parts, this handle that goes onto this pole. And I said, yeah, that's right down our alley. And then he said, can you do it in 2 weeks? I said, oh, no. Usually it takes 4 to 6 weeks, if not longer. And I said, are you crazy? 2 weeks is just not realistic, So, but anyway, after some deliberation, we said, okay, we're going to do our very best. We said, here we have a company willing to reshore back to the US, and we are manufacturers well within our capacity and capability to step up and really help them. Because if we don't step up and they won't feel loved and supported, it will be an issue. Then we're not doing our job as manufacturer domestically. So anyway, we both stepped up and just throttled up, and we were able to finish the handles in half the time, in 3 weeks, 3.5 weeks. Yeah. So yeah, it's, of course, all this is Maryland came to the rescue. And I think if we did not step up, we would have lost this opportunity. And I think the lesson here is that we as manufacturer, we have to be sensitive to companies that are coming back, that any opportunities we have, we should just give them 110% of our support. And yeah, and at this point, we've been seeing lately in the last year or so that more and more companies are looking for manufacturers in the US domestically versus going overseas. And of course, they got the tariffs to pay too, and the economics also. In China, labor cost is going up. They're trying programs in certain areas where they would have like what we have, the Social Security insurance and all that. So the manufacturers in China also, their cost of manufacturing is creeping up. So yeah, so it gives us manufacturers in the US the opportunity to really step up and grab some of these opportunities. And yeah, so I guess, yeah, that is kind of the crust of that effort. Yeah.
That's a great story, Luke. And I think another great example of what you just said. It's Maryland companies and Maryland manufacturers coming together to solve a problem.
Mhm.
I know Mike and RMI and MEP, we get asked that question all the time of what is Maryland manufacturing and what are we good at? And you just hit the nail on the head. We're problem solvers here in Maryland. So
Yeah.
thank you for your efforts and for the work that you all are doing in trying to step
Yeah.
in and fill a void in the supply chain.
Mhm. Thank you. Yeah.
Great. And finally, last but not least, to our next panelist, Marty Rosendale is the CEO of the Maryland Tech Council. I think many of you know Marty. The Maryland Tech Council is the largest life sciences and technology organization in the region. And Marty's story touches on one that is probably forefront in the news right now, which is the development of a vaccine and the race to develop some therapeutics and vaccines for the virus. Marty, can you share a little bit about what some of Maryland's companies are doing and how they're recruiting and what their workforces are doing on this front of the development of a virus vaccine?
Sure, I'd be happy to, Mike. Thank you. And thank you for that introduction. Also, thank you to Mike Galeazzo and Stacy. This is an amazing event you've pulled together. I'm really impressed by the people that I see here and the number of people that have shown up and shown interest. So I'm going to take you back for a second to the early days of the pandemic. First, sometime, say February timeframe. When the pandemic, when it first became apparent that this was going to be a pandemic, we immediately realized that there were things that were in short supply. And one of the first things were PPE. And a lot of the panelists today have already talked about how companies have pivoted and collaborated. Rick, I think you were the one who said that there was an amazing amount of collaboration between competitors and industry partners that went on. And I think when we get beyond this, when we look back, we're going to see thousands of heroes that stepped forward and like firefighters ran into the fire to be a part of this response and make these things happen. But we saw things like the Naval Surface Warfare Center in Carter had 100 3D printers at their disposal. And we were able to connect them with, there was a collaboration, a coalition of manufacturers that were printing, 3D printing face shields. And so we were able to make these kinds of connections, and we formed what we call the Maryland COVID Coalition. Now, I'll come back to the vaccine, but I want to make another point since this is a discussion on manufacturing. Early on, we saw that with respect to testing, we had a shortage of tests and we had a shortage of sample collection kits. Right here in Maryland, we have amazing companies in the diagnostic space. So the first thing that happened was our clinical labs throughout the region stepped up. They said, well, the manufacturers can't ramp up fast enough. So those clinical labs became manufacturers, and they began manufacturing their own sample collection kits. And we saw them ramp up their capacity to do PCR testing. In just a matter of weeks, they ramped up their capacity to over 100,000 tests per week, which was a phenomenal event. But that also bought time for QIAGEN and for Becton Dickinson to ramp up their manufacturing. QIAGEN began hiring temporary staff immediately and began ramping up their sample collection kit manufacturing to satisfy that need. Becton Dickinson began ramping up their PCR testing capacity. Becton Dickinson also went overseas and imported sample collection kits at the same time. So the fact that our clinical labs could become manufacturers for a brief period of time bought time for the large manufacturers to ramp up for the worldwide supply and take care of that shortage. But then, Mike, you talked about the vaccine. If we look at the vaccine development, in early January, when we were just hearing about this, all of the biopharmaceutical vaccine manufacturers, everybody in that space, we were all out in San Francisco at the annual JP Morgan Healthcare Conference. And while we were there, the US got access to the gene sequence of the COVID-19 virus, SARS-CoV-2. And so the community immediately began to huddle. What are we going to do? How are we going to respond to this? What can we do? By the time we got back to Maryland, so this is now middle of January, the time we got back to Maryland, the plans were already being put in place. Companies like Novavax and AstraZeneca, GlaxoSmithKline, Altimmune, Scenaria, Immunomic Therapeutics, all pivoted to manufacture a vaccine or a form of the vaccine. And they did this before they knew whether there was going to be any government funding. Now, we assumed that there would be, but they did this on their own dime. They made the decision this had to be done. It had to be done fast, had to be done faster than anybody had ever done it before. And so they began the process immediately. They had the gene sequence. They could start producing virus particles. They could start making these vaccines. So that process began. Then the government began to catch up, and the government began funding it. Operation Warp Speed became a funding program. And I don't know if you all realize it, but the vaccine industry and the cell and gene therapy industry here in Maryland is predominant, and about a third of that funding was sent here. About a third of that Operation Warp Speed funding was sent here to companies in Maryland. Again, companies like Novavax and AstraZeneca. And then in addition, there was other funding. Novavax got $400 million from CEPI, which is an organization that's focused on pandemic response. And a lot of other funding came in as a result of this as well. So these companies immediately pivoted, started working on these vaccines. As soon as they had a vaccine candidate, again, they knew that this was going to be necessarily a rapid response. They began manufacturing. They went to other Maryland companies, Emergent Biosolutions, Catalent, and they immediately began manufacturing before they knew whether their vaccine candidate was going to be approvable or not. So while they're developing the candidate in the lab, they've identified it. Now they're already manufacturing it. That's how Pfizer is going to be able to deliver 50 million doses before the end of December. That's how AstraZeneca and Moderna are going to be able to deliver doses before the end of December. So the manufacturing ramped up immediately during the development. As a result of all of this and the collaboration that went on, and I'll come back to that collaboration in a minute, these vaccines are going to be ready in record time. If any one of you would have asked me a year ago, how long does it take to bring a vaccine to market and how much does it cost? I would have told you $1 billion in 5 to 10 years to bring a vaccine to market. Well, the cost hasn't changed. It's still $1 billion, but we're doing it in 10 months instead of 5 years. That is unheard of speed. And we're doing it without any shortcuts with respect to safety and the regulatory process. I can tell you when these products come to market, they've been tested, they've been thoroughly tested, the FDA has reviewed them, and I can tell you that myself and my family, we're going to get these vaccines as soon as they're available to us. And this feat is nothing short of amazing. So at the same time they're developing, they're manufacturing, they're starting to put things up and putting them in inventory. They're making decisions about logistics because some of these vaccines have more logistical challenges than others. So all of this work is going on simultaneously. And then we have organizations also here in Maryland, like the U.S. Pharmacopoeia, which is a standard setting organization that's also monitoring the supply chain. And they're keeping an eye on, all right, so what's happening with respect to the supply chain? Now, we've already heard this morning that there are issues with companies that have been getting supplies from overseas. We knew that was an issue. But the other issue that came up is every one of these vaccine manufacturers is using the same starting materials. Every one of them needs the same RNA, the same viral particles, the same culture media to grow these materials up. And so there were immediate supply chain challenges that had to be dealt with. And again, the industry came together and figured out how do we resolve this? How do we make sure that we can all proceed with these vaccines, because we know one vaccine is not going to be enough. We're going to need a dozen vaccines in order to make this work. And they came together and they solved those early supply chain challenges. Now we're looking at downstream supply chain challenges. And how are we going to resolve that? Because there's materials necessary for QC testing of hundreds of millions of doses of these vaccines. There's materials for packaging. For a short period of time, it looked like there was going to be a shortage of glass vials to put these vaccines in that needed to be resolved. And so again, the industry has come together and collaborated to make sure that we can find solutions for these supply chain challenges. And as a result, we're going to have a vaccine in our hands next month. We will see immunizations taking place next month. We, the general public, my guess is, will probably start being vaccinated as early spring, March, April timeframe. And so this wouldn't have been possible without an amazing level of collaboration, cooperation between all of these industries. And in the meantime, we have other companies right here in Maryland, Zolgen, others that are working on new diagnostics. We're seeing at-home diagnostics for COVID-19 now. I got an email from Care First Blue Cross Blue Shield on Monday that offered me at-home diagnostic testing for COVID-19. That was technology that wasn't here, wasn't available 9 months ago, that we've been able to not only develop, but manufacture and distribute within a very short period of time. All of this work is happening right here in Maryland.
Rick, I'm going to interrupt you, but I'm going to stay with you and transition us to the next question. But before I do so, if any of the audience has questions, please feel free to type those into the chat function, and Stacy or myself will ask them. But Rick, Marty, staying with you for a second. We've just heard some great stories about partnerships and collaboration and innovation and everything from students on up to established companies. So obviously none of us want another COVID-19, but what can we do in Maryland to ensure that we keep this momentum, we keep this type of interaction and collaboration going, so that we have the next round of champion stories, we have the next round of talking through how this ecosystem is functioning in a time of normalcy. In a sentence or two, what would you say we can do in Maryland to make that happen?
You're gonna force me to say it in 2 sentences. First of all, it was already happening here, Mike. I can tell I've run companies in Southern California, Northern California, and Pennsylvania, as well as Maryland. And the reason I kept coming back to Maryland is because of that collaboration that I saw here that I didn't see anywhere else in the country. So it was already happening here to some extent. We just need to keep encouraging it. We need to have meetings like this. We need to have conversations. We need to let people know what the collaboration opportunities are. And we need to connect people. So much of what the Tech Council does is we focus on making connections. As long as we keep doing that, we'll continue to see this kind of collaboration.
Great, thank you. Luke, how about you from your standpoint? You're seeing changes to how the supply chain operates and how the world of contract manufacturing operates. In a sentence or two, what can we do as a state or as a community or as an ecosystem to speed that momentum? You're still on mute. There we go.
Yeah. Okay. Thank you. No, I think like Martin was saying, I agree. Connecting is so very important. I think a lot of times we have capability and capacity, but we don't know where the need is. So if somehow there's a bulletin board somewhere saying, hey, I need vials, I need it in glass, I need it in plastic, I think a lot of manufacturers could step up. And if they can do it, I think, that would be a good solution for everybody, right? Someone in need, and here you got someone who's capable and make it happen. So I think a lot of times we manufacture, we don't know where the opportunities are, where the need is. And yeah.
That's
put
great
up a
input.
big bulletin board.
I think Mike's probably working on that right now while we're on this webinar. Rick, how about you? You guys are a company who have been able to find opportunity in this challenge. What can the state do, or what can we do as a community to make sure that we're supportive of that we're supportive of the next company that's looking for that opportunity?
I'd like to take it down just a level beyond the communication at this high level with executives that are on this call. I would really encourage the state to engage in providing resource and support to educate young students, young Marylanders, to get into the trades, to get into manufacturing. There's such a shortage of young students and young people who are even entertaining getting into manufacturing. There's a stigma that has been created that people in trades are not valuable, or people in manufacturing are not as valuable, and that's truly a sad state. And I think that as a state and as a nation, we really need to encourage our young Americans to re-engage in those manufacturing positions and those technology, electricians and plumbers and steam fitters, so that we have a base to build from.
That's actually a great response, and you just made my life easier, because now I'm going to throw that question to Mary and say, Mary, we've got nearly 100 folks on this webinar today who are all happy to talk about manufacturing all day long. How do we send that message to your girls, to your students, to get them excited about becoming that next generation of problem solvers?
Yeah, I think Mike, you hit the nail on the head when you said problem solvers. I think allowing students to see the opportunities that they have to use their skills to solve problems. I think engaging with industries, understanding what the problems are that exist, and helping them kind of explore opportunities there to offer, some what I would consider experiential learning experiences for them. I think those opportunities outside the classroom are as valuable, if not more valuable, in the life skills that they're building, the career skills that they're building, than what we can offer in the classroom. It's one of the reasons why our STEAM program is built around innovative technologies. We work very hard, and we have very generous donors that allow us to bring industry standard equipment and software. So our students are very knowledgeable about, when they get into an industry, how it works, what's the platforms that things run on. And of course, we're always looking to engage corporations in getting students to have experiential learning experiences. I think you can't underestimate that spark, that kind of problem solving opportunity that students thrive on.
Thanks, Mary. And I know we're almost out of time, but Michelle, I believe you have a quick comment you wanted to add in.
This is Michelle Welly. Michelle, you still on there?
I'm sorry.
muted,
I'm
Michelle.
sorry. I was muted. Yeah, I just wanted to follow up really quickly with some of the comments that Marty made about collaboration. I think it's really important, and Marty and I have talked about this. I mean, the Economic Alliance is focused in the greater Baltimore region. MTC is so strong in the life sciences, particularly along the 270 corridor, Montgomery County, Frederick County, Prince George's County, and looking for synergies rather than points of competition and conflict between the jurisdictions is incredibly important. And I pledge to you, Marty, we need to do a better job of it, your organization in mind, but we've reached out, particularly with life sciences and cybersecurity, because the assets in greater Baltimore are amazing, and the assets in the DC region are amazing. Put them together, and we can blow anybody out of the water. So I just wanted to make that comment.
If I could follow up on that quickly, Mike. So first of all, Michelle, I absolutely agree with you. We need to be better at that. I don't know if you all realize it, but when it comes to life sciences, we have a strong cluster along the 270 corridor, but the second largest cluster in the state is in the greater Baltimore region. And so it's also very strong, and it's what makes us so strong overall. But I also want to come back, Mike, to the workforce issue. with respect to manufacturing, because I think there's a stigma of manufacturing that all manufacturing is assembly line work. And I don't think our young people understand how exciting it can be. I started my career as a tool design engineer, later became a microbiologist, which is how I got into biotech. And when I talk to people about manufacturing and the excitement, they start out the conversation thinking I'm nuts, because I'm talking about how exciting it is to actually make something tangible. And I think there's this stigma of manufacturing in general, that all manufacturing is somehow assembly line work. And I think we could do a much better job educating our young people about how exciting it truly can be.
Yeah, Martin, I totally agree with you. We started as early as our middle level school program, where our core curriculum engages students in design and design process and engineering and computer technology, because we have to grow those interests and those beliefs and those dreams early enough that they are engaging and electing to do it when they come to the high school, because it's part of their elective program. But as soon as you can show a student how to go from an idea to a tangible object that then needs to be redesigned because you have your next idea, it really sparks that love for manufacturing, I think.
Great input. We do have time for a few questions. If anyone else would like to ask a question, please let us know. We can certainly unmute you. Well, Stacy, with that, I will turn it back to you. I just wanted to add a few thoughts in closing and say, you know, as the MEP, and I know Mike would probably echo this as RMI, if people aren't inspired by this conversation and the stories of what's going on in Maryland, you know, I look at this as really a bright opportunity and a hopeful opportunity for the manufacturing community. We're seeing these stories of people doing just what we talked about. They're problem solving, they're collaborating, they're innovating, and they're really solving, you know, real world problems related to the COVID-19. So it's encouraging to me. It makes me hopeful. I know there's more opportunities out there. Mike shared the update on Peter Gourlay. I had a conversation with Peter just last week when he was at Hopkins, and one of the things he said was that the nursing staff said they can't find sanitary wipes to clean the hospital. You know, and that's something that we're working on in the state. And if we can't fix or figure out how to do something like that, you know, I think that's prime for what we're meant to do here in Maryland is solve those problems and strengthen our supply chain and bring some of that more local. Jim Reese, you know, typed in a message before he left, and he said, "Proud to be a Marylander." I thank you, Stacy and Mike, for letting me moderate this panel. I know I'm proud to be a Marylander, and I'm proud of all the companies that make it in Maryland. So, Stacy, with that, I'd love to turn it back to you, and thank you for the opportunity to share today.
Thanks, Mike. Michelle, did you have something else you wanted to say?
Just a quick thought. As soon as Mike concluded the question period, I had a question, of course, and this is for, you know, maybe after the first of the year. Going back to something that Luke said, is it possible for RMI, EAGB, MTC, or specific companies to begin to identify companies that had or have fairly significant supply chain issues, and see if we can begin to do a supply chain analysis, to Luke's point, to find companies that could plug that hole, in the supply chain, for companies who heretofore have relied on offshore partners for their supply chain. So just a thought for maybe we can talk about after the first of the year.
So Michelle, just quickly, so at the Tech Council, we've started the Business Continuity Task Force that is focused on helping companies. A number of the companies that have applied for assistance have supply chain issues, and so we can contribute to that fact-finding effort through that.
That's great, Marty. Thanks.
Michelle, this is Mike. Yes, we absolutely will work on that with you and Marty and Mike. There's a need for that. Actually, I think you're hitting on an issue, and everybody's been talking about this. That's a need for America. American manufacturing, I kind of think, really needs to take a look at their weaknesses and start building, changing those weaknesses to more positives. So let me just end by thanking, if I don't mind, Mike Kelleher, thank you. I want to, and Stacy, I know is going to thank the panel, but I know Stacy and I were getting a lot of thank yous, but let's not forget Peter Gourlay was central to what we did with Champions. And I know you know that. He's down in Houston. He's not with us today, but he was such an important part of the concept of what we did this year. And personally, I got to say, we could not be where we are today if it hadn't been for Stacy Smith. So, Stacy, I want to publicly thank you.
Thanks, Mike.
And take it away, Stace.
Okay, just to wrap up, just thanks to all our panelists, our sponsors, our partners for bringing this program together for us today. Just want to let you know, if you go to RMI's website, rmiofmaryland.com, you'll see that our next program is December 4th. We have a discussion with Peter Francho, Maryland's comptroller, and Anubhav Basu, Maryland economist. And on December 10th is our next Champions webinar, which is energy efficiency success stories. And we'll be featuring some of the champions who have some energy efficiency success stories to share with us. So that concludes this program. We will send out a recording link and contact information for our sponsors and our partners and our panelists in an email later today. Thanks, everybody.
Thank you, Stacy.
Thank you, Stacy.
Thank you.
Thank you all. Stay well.
Thank you.
Yes.